let's talk about acne. So we have the skin disorder, which is very common. It is seen in teenagers on the face, neck, and back. What do we know about acne in terms of its classification? So we know that acne is divided into three classifications: mild, moderate, and severe. Mild is when we only see like blackheads and whiteheads on the face of the affected person. And we also see that it's very rarely there is one pimple or two pimples. Okay, so that's mild acne. But then there's moderate acne. Moderate acne is associated with widespread papules or bumps, right? But they're not infected at the moment. They do not hurt. There's not much pain or inflammation around it, not much redness, right? So in severe acne, we see that the acne turns into inflammatory condition. It hurts, it has pus in it, it is painful, there is pitting, there is scarring, the bumps have turned into nodules. So that's what severe acne is. We have two classes in terms of treatment. For mild to moderate treatment, we have only topical treatment. We only give creams, and the creams are either retinoid or usually a combination therapy of a retinoid and an antibiotic cream. This is actually for 12 weeks. For moderate to severe, we keep the topical treatment as is, but if it doesn't work, then we switch to oral treatment. We can give oral antibiotics. If it's effective, we can give it for even more than 6 months. But for example, the topical retinoid creams are not effective, then we switch to oral retinoid. But that's very case sensitive, for only for severe acne. And oral isoretinoin is to be given only by the specialist. It cannot be prescribed by a general physician. And other treatments for acne comes in for women, especially there's an hormonal drug called Dianate. Dianate is also known as the beauty drug because it can cause multiple effects on the body, especially on the skin, that is considered as the beautiful criteria. So it actually helps in suppressing acne. But again, the important thing to remember about Dianate is that the risk of clot in your body increases threefolds. That is something you should be considering about Dianate. There is a lot of minute details when it comes to the topical and oral treatment for acne, because we need to figure out if we are causing the local bacteria to become resistant. So we need to make sure that the treatment is effective in terms of balancing the skin and we're not over treating acne.